here right now, right? But I'm really glad to be here, and thank you. And let's keep, this is not formal in any way. Lots of Q&A, whatever you guys want to ask, pick my brain. If I have the answer, I'll give it to you. If not, we'll figure it out together. So, you know, why am I here? I'm here because I do anything for George. He's a great guy. That's number one. Number two, I have no social life. I spent the last 6.5 hours sitting in a bench watching my son wrestle in Bayonne. So I have nothing else to do, so here I am an hour and a half away. So I figured to come here. And number three, I'm a total geek. I'm a podiatry, sports medicine, running geek. I love this stuff. I love learning from you guys. I love learning from the retailers. The one thing I've learned, I've been doing this for 27 years, believe it or not, and one thing I've learned is that when you guys have injury, you don't come to me. Where do you come when you have a problem? You come here first. And you say, hey, Kevin, man, my heel hurts, or my calf hurts, or the ball of my foot hurts. What should I do? So these guys have lots of information. But the one thing I don't like is misinformation. So that's why I want to try to give as much information as I can today and kind of clear some of the myths. I never say that word, right? The myths, you know, as much as we can. So, you know, the biggest topic, and I have to say it's become like an epidemic now, is what? Heel pain, heel and arch pain. So most of the time, when we think heel and arch pain, what's the condition? What do we call it?
Plantar fasciitis.
Incorrect. Right. That's what everyone says, right? So plantar fasciitis is not a heel spur. That was great in 1982, but we've kind of progressed from that. We've learned that the spur itself has absolutely nothing to do with pain. The spur is embedded in muscular tissue, and it's just a secondary finding. So plantar fasciitis, what does the word mean? Plantar fasciitis means an inflammation of the plantar fascia, which is a connective tissue on the bottom of your foot that comes from the heel bone and goes to the toes. Has 3 different slips. So it means it's inflamed. But a lot of times patients go, well, you know what? I've taken Advil, I've done the ice, I've rolled my water bottle. Nothing's working. It's not getting any better. I went to my doc and he gave me injections. Still not getting better because it's not inflammation. It's no longer. The real terminology we should be using is plantar fasciosis. So osis means scarring of. So what happens usually is that as runners, it's overuse injury. We're running, we're pounding, we're doing lots of things. And what happens is over time, that area becomes scarred. And as it becomes scarred, it becomes less elastic. It's more like a rope, the fascia, as opposed to like an elastic band. So it's just there to hold everything up. It's in the first layer of muscles. If we open up the skin of the bottom of the foot, there's the fascia. But what happens is that as our foot goes through its motion up and down, it starts to pull, and sometimes it tears. So, you know, one of the things that, you know, I've learned over the time is that, you know, we're all athletes, right? But we're all at different levels of training. And sometimes we train too much, too soon, too often, with too little rest. So that's the reason why we get a lot of this heel pain. So, you know, it can be this plantar fasciosis, and I'll talk about ways we can deal with that. But here are some of the zebras, okay, the things that it could also be that we're missing. So it could be a stress fracture. So what's the difference? How would you know the difference? So typical plantar fasciitis, people say, first step out of bed, I get out of bed, I step down, and it kills me. I walk a little bit, go to the bathroom, do my thing, and it feels a little bit better. Then at the end of the day, it starts to hurt again. So that's typical of fasciitis, fasciosis. And I'll use those interchangeable. A stress fracture, people will say, it doesn't hurt in the morning, but during the end of the day, it starts to hurt a little bit more. And it starts to hurt definitely at my run. So that's becoming a small line, a fracture through that area. So if that's been bothering you for longer than 2 weeks, and you've gone to Kevin, and Kevin's tried all those tricks, maybe that's time to see a sports podiatrist, someone who can help you out and maybe take an x-ray and figure out what's going on. So that's a very typical thing that can happen.
What's the bone that fractures?
The large bone in the back of your heel is called your calcaneus.
Calcaneus.
Yeah, and it's a major weight bearer of that area.
Yeah.
It's kind of funny though, but I say in the U.S. there's 3 million visits for heel and arch pain, and you know many times people just think it's fasciitis, but so many of the times it's something like this to the calcaneus. So what else could happen to that calcaneus, that heel bone? Sometimes people say, well, you know, it's not just this just burning. It's not just a pain. It's like a burning pain. So it kind of radiates to the bottom of my foot. Does anyone here have heel pain or have had heel pain? Yeah, so a bunch, right? Sometimes it radiates to the other side of the foot. and it really is uncomfortable. And with every step it hurts a lot. So there's also a nerve that goes from the inside of the foot over to the outside of the foot, and that sometimes gets compressed. And that could be what's called a neuritis. And there's different things that your sports doc can kind of work at and see if it is that or is not that. So that's another one.
What tendon is that? I'm sorry, I keep asking you.
Yeah, no, that's really good. That's a nerve. That's
Nerve,
the medial plantar nerve of the foot, and it kind of shoots across and branches right there. So what we do a lot of times with that is that we might even just give a small injection of just lidocaine to see if that helps. And if it helps, you're like, oh, that's the right spot. Then we know we got the right thing. As opposed to, I really try, in my practice, I try to avoid things like cortisone injections, unless the patient's like, listen, I got to run this marathon in a month, and which I get a lot.
Nobody here would do that.
No. help me get there. So sometimes I'll twist my arm to do it, but it's rare. I do that. I'm not a big injection guy. I find the biggest reason that people have these kind of problems, though, like in my practice, people come to me, I don't get healthy runners, okay? I get people with pathology, right? So I get people who say, this is bothering me because of this. So there's a renowned biomechanist, his name is Ben O'Nig. You ever heard of him before? So Ben O'Nig is this awesome, older guy now, and he said that we have this preferred movement pathway. So we all kind of move a certain way. But what happens sometimes is that we stop doing the things that make us efficient. So as we become less efficient, some of those asymmetries become a problem. So I'm sure Kevin does this here sometimes. You might even just watch people move and walk back and forth, and you might notice, wow, that guy's off a little bit in that way. But that's maybe their pathway. That's how they do it. But maybe there's a weakness. And usually what I find, the weakness is not just in the foot, it's higher up. It's usually in the hips, it's in the core. And I always find a strong runner is a much better runner, a much more efficient runner. A runner doesn't have these issues. So the first thing I do when I have my runners come in, if they're high school runners that come in, I say, all right, hands on your hips. Everyone do that. Stand up for a second. Let's try this. I'm going to put you to a test. Hands on your hips. Everyone's going to get involved. Everyone's an athlete, right? Okay. Just want to see you balance on one foot. How long can we do that for? We do that for, it's hard, right? It's a little hard. All right, now as we're doing this, I'm going to do like 3 little squats. 1, 2, 3. 1, 2, 3. And I see some people doing perfect jobs and some people a little, maybe some of those Brooklyn Lager, but you guys can sit down, good. So when I look at that, if I watch a runner, if I see a runner doing a little bit of this, think about what we do, and every time we run, we're doing that, right? So we have to be able to bring our knee right in the right position. And sometimes it depends, do we have weak glutes? Do we have weak hips? What's causing it? So if we were to do this, and come down, somebody see the person going in like that. That's telling me that the small hip flexor there is kind of not holding the foot out, the leg out as much. And what happens to the foot? It rolls in. So that's going to cause an overuse injury to the plantar fascia. So that's sometimes where it comes from, as simple as that. So one of the other myths that we have is that there's a magic shoe. Right?
That's good for plantar fasciitis.
Yeah.
61 degrees. We're 61.
How many times do you get that? What's the plantar fasciitis shoe? What's the bunion shoe? What's the neuroma shoe? Right? There's no such thing. There's no magic shoe. And what I also hear a lot of times, it really just kind of drives me nuts. They'll say, well, I went to, X shoe store, and they watched me run from behind on the treadmill, and they say that I pronate. Well, you should pronate because that's normal. Pronation is not a pathology. Pronation is a movement. And who knows what the abnormal movement, what abnormal pronation is? No one knows that. So it's okay to pronate. Okay, that's part of that whole thing, that preferred movement pattern. So, and we also know that no shoe is going to change pronation. Sometimes motion control shoes can actually cause more pronation. So find a shoe that makes you more comfortable. Because if you're more comfortable, you're going to be more metabolically efficient. So find a shoe brand that maybe has lots of options, like 361. Okay.
That's an unpaid advertisement.
That's right. So 361 is great because they do have. I call it the every band's shoe. It's not a specific shoe. It's not a big giant foam shoe. It's not a minimal shoe. They got a little bit of everything in there. They have this quick foam technology, which I'm sure George can talk to you about a little bit more, which really adapts a lot to as you wear it more and more. So it's really a very cool shoe to wear, a very cool brand. And it's been around for a while, right?
Yeah, it's an international company that's been in the U.S. now for about 4 years, I think.
Yeah.
Yeah.
My kids were really kind of amped about 361 when I saw the Olympics a few years back, and all the swimmers were wearing 361 and stuff like that. So it's becoming very, very cool. Very big in
Swimming in those shoes is a problem.
Yeah, it's a problem.
Yeah.
That's for sure.
You should have seen how many calls I got for swim caps after the Olympics.
Yeah. So say you try all these things, for your heel pain, and things aren't getting better, So what do I do? What's new and what's cool out there? So, yeah, people all know what orthotics are, and people all know the injections and oral anti-inflammatories. But what if those things aren't working, and physical therapy didn't work, and rolling a lacrosse ball isn't helping? So the newest and greatest thing in our toolbox as sports medicine podiatrists is shockwave therapy. Shockwave. Has anyone had shockwave therapy? Yeah, I don't mean for your mental problems. Yeah, no, shockwave therapy is
It worked.
Yeah, exactly. It's a propulsive wave of energy that we utilize nowadays. And it's basically a lithotripsy machine that we used to use to blast kidney stones. And now we use it to cause little holes in the plantar fascia that causes new blood flow. So it causes something that was once scarred to become inflamed once again, become healthy again. So that's the latest and the greatest. Love it. Usually got to do about 3 or 5 treatments. Is that what you had?
3.
3.
Yeah.
And where was yours was heel pain, right?
It was perineal tendinosis.
Tendinosis. Good man. That's the part for me on the quiz. And it's 3, and you got better, right?
Yeah, 3 treatments over a 6-week period, and magical. I mean, it took a while. I was getting discouraged, but then it just kicked in.
Mm-hmm.
And you could play the violin.
And I could play the violin.
That's right.
Yeah, because a friend of mine had the same treatment, and she's.
Is she doing well?
She's still waiting. I don't know what happened.
Yeah, and there's different ways of doing it too. There's different, obviously, technologies and different machines. But we can always talk about that.
Okay.
Yeah, it definitely. It's also not a magic bullet. Okay. It's definitely something that augments other things. So you can't just do that and not have good core strength. And you can't have the right shoes, and you can't train properly and improperly, and you can't have a bad stride. Okay, so the one thing I've learned from the minimalist movement, so we went to Trey. I don't know if you were there about 5 years ago. Were you there?
Yeah.
5 years ago, everyone was walking around with vibram 5 fingers. Everyone, and it was kind of cool. It's like, hey, how you doing? It was like like a hippie convention. Now there's no vibrams, of course. But the one thing we learned from the whole minimalist movement is that stride and stride length and cadence and where you put your foot in relation to your center of mass is so important. So it's hard to change the way you run, but there's different drills and things to strengthen yourself, become more efficient as a runner. And I think that's what we learned from that. Because when you wear a minimal type shoe, you don't want to land on your heel. Okay, that hurts, right? if you're wearing no shoes, right? And true minimal shoes is no shoes. Okay, that's true barefoot, right? Does anyone here run barefoot? Does anyone try it? Yeah.
I discovered that when I was in my 40s, when I was young, I liked to run barefoot.
Yeah.
And then I decided. Then I started thinking, I'm doing all those miles. How come that my calves never have it? While I remember when I was young and I was running barefoot on the track, like 300 after the race, it was. So it means that the shoe comes straight my foot and makes those muscles weak. So then I made the point to kick up my shoes, run on the beach barefoot, run on the grass.
I think there's definitely something to be said for it, as a training tool. It's really important. But, if you think back, and Kevin, I'm not calling you out on this, but probably 30 years ago, right, when there was less injuries, I think.
Yes.
Less running injuries, right?
Yep.
Or we were just tougher back then.
Yeah.
Now the shoes were
Yeah.
less, and
So
there's
what-
less running. And
Well, in marathons, there was less injuries, that's for
more
sure.
miles, and
So why is that? Well, 30, 40 years ago, when people ran the New York Marathon, it was this many people.
Right.
And they were elite.
Yes.
And they were efficient runners. They knew how to run properly. They were strong. Now, I worked the finish line this past marathon. 50,000 runners. So I could tell you, I was there when the winners finished,
Yeah.
And I was there when the bartenders were finishing, you know, so, and it was like a big difference, you know, in how they were. So a lot of those people are just not ready to run or not ready to run minimal or do different things. So it's really important. You have to, you know, I have 3 kids and they play baseball and do all this kind of stuff, and we taught them how to hit, and we taught them how to wrestle, we taught them how to hit a jump shot. No one teaches anyone how to run anymore.
No.
You do.
Try.
Yeah, you do it probably at a young age. That's important. You know, what's the proper things? You know, how to get your core strong, how to do your planks, and how do you do your dynamic warm-up, and how to stretch afterwards, and those things are really important. So, you know, if you have young runners at home, it's really important to educate them on those things early on, and try to help out. So that's kind of all I really want to like chit-chat about, but I want to answer a lot of questions if you guys have about any topics related to the foot and ankle. What do you guys have? Anything? Anyone have any foot problems right now? What do you got?
Second toe joint inflammation because of a bunion.
Because of a bunion. So you tell me if this is the case. So what happens a lot of times is that, you know, a bunion is a malalignment of the big toe joint. Pushes over towards your second toe. Sometimes that second toe pops up a little bit. Right? Yeah, or cocks up a little bit like this. Pulls back.
Exactly.
It's very cool. Are you his wife?
Yeah.
Yeah, ugly, right?
Oh,
But
it's
no, so you know, and what happens is that now you're not as efficient. So when we run, we have to propel off that first metatarsal joint, that bunion joint, to go forward over a center of mass. You can't do that. So what you do probably is you kind of push off a little bit, like a skater would do, kind of push that way. Do you get a callus on the inside of your big toe?
Yep.
Yeah, because you're pushing that way and you're causing this pinching that occurs. So, you know, what would I tell someone like that? I would say you go to Kevin and you ask Kevin, which shoe do you have that has a large amount of toe box for that individual? You know, and I'm sure you have plenty that you would recommend for. Or you might actually even have a limitation of motion at that big toe joint now. So if you have limitation of motion, you're pushing everything laterally towards the 5th toe, right? So that second toe cocks up. If you push on the bottom of it, it hurts like heck. Sorry. And it causes some problems there. So the toe space is important. It's important to have a little bit of midfoot support as well, perhaps. I don't know if you
Surgery recommended for that?
Pardon me?
Surgery?
Surgery. So I don't think surgery is a cure. I think surgery is something that if your activities of daily living are affected, that you're cursing your foot out every day, then it may be time to talk about surgery. I think there's a lot of other things that we could do first before we get to surgery. So I like, you know, wide toe boxes. I like wearing things like correct toes. Do you carry correct toes?
I don't, but I just heard about them recently.
There's
Yeah.
plenty of it on the internet, and you think it works.
It does work.
Is
So
that like a
it was-
spacer? Toe spacers?
Yeah, it looks like
Yeah.
silicone brass knuckles for your
Yeah.
toes.
Toe
Yeah.
spacers.
So it goes in between
Yeah.
your toes. It definitely makes your foot wider. It makes it much more efficient. What I do in my practice for someone like yourself, I would say wider toe box, toe spacers to wear while you're running, metatarsal pad back further, not on where the area is, but further back.
Right.
You know, really makes it. Put that right on your sock liner. Do you carry metatarsal pads here?
Yes, yeah, we have the Spenco ones, and then the Curex inserts, they have them at.
Yeah,
built
Curex
right
insoles are
in
great.
that way back there.
We utilize them too. There's a thing called PEDAG. I don't know if you ever heard of PEDAG. It's another kind of, you can just tape it right into the sock liner of the shoe, and that kind of helps as well. I also use KT tape to yank your toe down.
Yep.
Are you a therapist?
I do it for
Toe
them.
right down.
Yeah, you pull
No.
it down into a
I've
plantar
just
flex
learned.
position. Yeah, it works great.
Looks great.
Keeps them from complaining.
Yeah, exactly. Yeah. But you know, so one thing I've learned is if you tell a runner, all right, don't run anymore because you have an injury. No. I would say, hey, thanks a lot. Look at another guy. So you can't do that, right? So what you got to tell a runner, there's such a thing as rest, absolute rest, and relative rest. So you're doing relative rest. So you're still running, but you're changing your gait pattern and movement patterns a different way. I mean, you could also cross-train, right? Do different things, which you really should do. You should get on the bike. You should get in the pool if you want. Get on the elliptigo. You know, you sell ellipticos? Yeah, I have one. I love it. I get honked at by all my kids' friends. I think I'm a total geek, which I am. But it looks kind of funny. Things like zero runners. I don't know if you heard of a zero runner. by Octane Fitness.
Yeah, he's
Yeah.
got one in his garage.
I have one. I love it. You know,
I'll rent
Alter
mine.
G's. An Alter G is something you could get at a therapist or a place like that where you can actually change the amount of gravity that you have so you can still run. So those are all things you can do. It's just you never have to stop. Okay, you just have to change the way you're doing things. I find pool running is really, really boring. But if you want to do
2
that,
hours at a time. We'll talk about boring.
yeah. So God bless you. You know, you're Zen. I don't know, but you can do it. But I just couldn't do it. But yeah. So that's a really good one. Who else has an issue? Anyone else have a problem?
No, but
What do you have?
Plantar fasciitis, which I guess is plantar fasciosis.
Good. Now, are you a student right now?
Yeah, I run at UPenn.
You do. Okay.
Mhm.
So tell us your story.
I got plantar fasciitis in July. I ran all of cross country season with it, and now I'm just doing every other day running this past week, but it still hurts.
Driving you nuts.
It's
So-
gotten worse.
So the most important thing when you go visit your doctor
Mhm.
is he listens or she listens to you,
Mhm.
right? So you got to tell your story, and your story is when do you feel the pain?
Definitely like right when I first wake up, but I wear one of those night splints to sleep now, which definitely feels better,
Yeah.
but it basically hurts like every step I take if it's walking or running. When I'm sitting down, it'll hurt. Yeah.
And what's your weekly mileage usually before this?
It was like 50 during cross country season, and this week it's gonna be 12.
Yeah.
That's good.
So your conditioning is definitely being altered.
Yeah.
Yeah, which is driving you nuts mentally,
Yeah.
I'm sure. What has made it better?
Well, I took some downtime, and that definitely has improved it a little bit. I roll it, ice it, like do all that stuff.
Yeah.
My trainer at school actually mentioned shockwave therapy as an idea when I come back from break in January. See
Yeah.
if that'll help.
Absolutely.
Yeah.
Yeah, and if you need connections with people who have it, I'll help you out with that too. Yeah, by all means, I think that's something to consider. The downside, there's always a caveat, there's always a but with Shockwave. Shockwave is a non-covered expense, so you have to pay out of your pocket for it, which, you know, some people just can't do it, and some people can. The reality, though, is that most docs, as long as they're not being pigs, they will do it for a fair price, and the reality is that by the time you were doing all the other things, it's probably less expensive to get it. It's a cure.
And how much is like a fair price?
So $150 per session is usually what the charge is, and you need about 3 to 5. So you could talk in upwards of $750, but it's a cure. You get better. You can run during it. You don't have to stop. You actually get better as you're doing it. So that's, you know, it could definitely. It's not for everyone, but as of now, that's how it goes. You know, especially if I see most of these patients who are recalcitrant. They've tried everything else. They come with their bag of stuff and they put it out. Like, this is my pad and this is my orthotics I got from 4 different doctors. They all stink. And I've had 4 injections of cortisone. Have you had any injections?
No.
Stay away.
Yeah.
Don't do it. You know, so those are the kind of things that you see and you really want to stay away from. So I get about 90% success rate on those type of patients like you. So, you know, it kind of, I don't advertise at all, so it markets itself. People put it out there and go, yes.
Yeah, I had plantar fasciitis too and found relief at night putting my foot on a heating pad before bed.
Yeah.
Somehow that was finally the
Yeah.
solution for me.
And it makes sense, right? Because it is increased blood flow.
Okay.
Sometimes it's not enough for some of these really
Yeah.
severely scarred ones.
Yeah.
Did you have x-rays?
Yeah, I had x-rays
Did you have an
in
MRI?
August. I didn't have an MRI, no. And, like,
Um,
since I've been at school, I haven't.
You should get an
like,
MRI.
Yeah.
Just to rule out, you know, the bad things.
Mhm.
Not covered?
Okay. Depends about your plan. Yeah, yeah. Yeah. Most of the time it is.
Now, why wouldn't it, if it's so successful and for such a common problem, why wouldn't?
I have no idea. I mean, it has some of the highest level, as level 1 studies of evidence-based medicine by peer-reviewed literature that proves that it works. So if you're in Europe, it's the go-to. It's the first thing they do over there. It was invented in Switzerland. The Germans use it all the time. That's where I got my training from, was from Germany. And I lecture about it now globally, which is kind of cool. You know, I definitely find it works. You know, the reality is that once some insurance company coder puts a price tag on it, I'm screwed, you know, because, you know, you make this huge investment in this thing, and they're going to say, Isn't that thing like ultrasound? And it's not. It's not ultrasound. It's not a TENS unit. I mean, my unit costs more than a Land Rover. So, you know, I want to make sure that this thing, you know, is utilized properly. So.
What is it that you don't like about the cortisone shots for it?
Yeah, so cortisone is a great medication, but what the whole idea behind cortisone is that it decreases healing time. So when you have hives, you take cortisone, and it decreases all those swelling, the things you have. Like we said at the very beginning, most of the time fasciitis is not an inflammatory problem. So we're injecting it into that area, and it's weakening it, and there's a higher risk of rupture. So you don't want to do that. Yes?
What's the percentage of people who actually tear theirs? Because I have like 2 teammates who both tore their planners.
Did they have injections?
No. And my one teammate like tore both of hers.
Yeah. It's higher in females than males. A lot of times it could be because of female triad. I don't know if you ever read about that.
Yeah.
Yeah. So it could be because of that. I couldn't give you an exact number. I'll find out for you. But it's very small.
Okay.
I would say it's less than 1%.
Okay.
Yeah, to actually tear, you know, your plantar fascia. So how would you know if you tore your plantar fascia? Did they have a partial tear or a complete rupture?
I think one of them was a complete rupture and the other one was just a partial tear.
Yeah. So, like, if you have a complete rupture of your fascia, you will know it.
Yeah.
Because your foot turns blue, you know, black and blue, it's swollen, and you can't put any weight on it. If you go get an MRI, tomorrow, they're going to say you have a partial tear. Everyone here gets an MRI tomorrow, they're going to say you have a partial tear, because you're runners. And they have to say something. You know, they're going to say, oh yeah, it's a little micro tear. So be careful with that too.
Yeah.
So that's the reality.
That's true.
What I usually do in my practice is that I also do diagnostic ultrasound. So if you can find a doctor that can do an ultrasound, that's dynamic, so you can actually see the consistency of that fascia in real time as you move it back and forth. I love that. That's a really good tool to have. I like that even better than an MRI.
Okay.
To be quite honest. So if you can find a doc that has that, and I'll give you my number if you want to we'll find you a doc that's good around here. Yeah, it's good. Yes, sir.
Well, for the first time in about 30 years, I have knee problems. I never really had knee problems, and I find I usually work out on the track.
Yeah.
And you know, tilting toward one side and then the other side, and I'm not sure whether that helps it or not. But I don't know what exercises to do for it.
Yeah.
I'm more or less not going to any doctor. I'm just
trying to fix it yourself.
Trying to fix it myself.
Yeah. So what I find a lot of times, you know, runner's knee, that we see a lot of times in individuals, it's because they do a repetitive thing over and over again. You keep making those left-hand turns right in the track.
But I do right.
You go the other way too?
Yeah.
That's great. What shoe do you wear when you run?
Like New Balance, Brooks.
You don't know which model though?
I used to get the highest value New Balance, like the 2001 or whatever.
Yeah, because it costs the most, right? Or you get like, you get the Cayano, or you get whatever, or the Brooks Beast or something like that. Because people say, wow, that's it's $160. It's got to be good. A lot of bells and whistles.
That's what I did.
I'm an outlier when it comes to this, and excuse me if I'm out of place here. I find I want most of my runners in the least amount of shoe that they can possibly withstand. So what do I mean by that? I always tell, I'll give a prescription, and I don't say you need a New Balance, you need a Saucony. You need a cushion neutral shoe. That's where I start people at. So I want a shoe that has more cushion, especially our maturing athlete needs a little bit more cushion. Okay, we want a shoe that that has a lower rear foot to forefoot drop. Okay. So I find that the traditional drop, most shoes are 12 to 13 millimeters from the rear foot to the forefoot. Like the shoe you have on right now is the 990. That's
just walking, right?
Yeah, that's a heritage shoe that's been around for about 25 years. Yep. It's a great shoe for walking, not a good shoe for running, because it is so high in the rear foot. So what we learned from minimal running, from barefoot running, is that when you land more midfoot to forefoot, and you land with more knee flexion. Okay? When you land with a shoe like that with a higher drop, you land with your foot further out behind here. So you go boom, and you're jamming down every time. And what happens with that is that your knee rotates in. So I love to get my runners, I'll tell the retailer if they could please put them in a shoe with a little bit lower drop than they're used to. I don't want you to go right to a 0 drop shoe, but I want you to go maybe to an 8mm drop shoe. Do you guys offer multiple different drops in your shoes?
Yeah.
So that's perfect. You know, so
You range from 8
361.
to 12.
So go to an 8mm drop. You know, maybe the Spire.
The Sensation.
The Sensation.
Yeah.
That's sexy. But yeah.
Yeah. The Merakis are 9.
Yeah.
Spin Jacks are 8.
Yeah, so that's what I would
Spires
do
are
for
11.
you to try first. You know, and see how that goes. Do you do any kind of core work right now?
I'm starting to do it now. I never really did it before.
Yeah.
You know, so.
Would you mind if I use you as an example?
Of course
Okay.
I mind.
Yeah. Stand right here.
I gotta say, though, in his defense, if you told me that I could run for 30 years without my first knee problem,
That's pretty
I'd sign up.
John's being brave. So this is what I would do with him to see about knee pain. So the same thing we did before with the whole group. Let's see what John does. Hands on your hips and just balance, foot up in the air. Is the right knee the one that hurts?
This sort of both.
Both? Okay. Just stay like that for like 10 seconds if you can. So it's a challenge, right? Just to do that, right? So every day what I want you to do is to brush your teeth on one foot. Just to get used to doing this, okay? If you get good at doing that, then I want you to stick this leg out. And I want you to do 4 of these. Let's look where his knee does. Boom. What did it do? See that? See what it did? It went boom, boom, right then. Do it again. Yeah. So he's struggling. You can see it. So this, your booty, it's all about the booty, J-Lo. It's all about getting this stronger. So what you got to do, put your hand right here, okay? And I want you to just do a raise.
That's what I've been doing.
Hold it up a little higher. Where do you feel it?
I feel it.
Yeah. Yeah, and go down. So you can do things like that. You can do with a TheraBand. You sell TheraBands?
I don't sell them, though.
He'll store it on Tuesday or Monday.
I'm trying to do something like that.
Yeah, TheraBands, just to go out like that.
Right.
You could do hydrants, right, with a TheraBand by yourself. You can do rotations.
Right.
You could do donkey kicks. You could do clamshells. Clamshells.
Yep.
All those things are really good for the hip, which will help your knee. And sometimes it's counterintuitive. You're like, why is he talking about the hip?
Right.
It's my knee that hurts. And if you go to your orthopedist, John, what's he going to say? He's going to say, well, you're 39 years old, and you're gonna need to get a knee surgery, right?
Yeah.
You don't need that, okay? You need to work on this first and keep running, okay? Big hand for John, thank you. So
Let me just jump in. So all those, I'm in the same boat as John. I've been running for a long time, but I coach high school girls now, and so we do core work every day. And so one of the ways I cheat as a runner is I get to do the core work with the girls, because if in your day you have so much time to devote to running. I say I got an hour to devote to running. I'm going to run for 59 minutes. I'm going to spend 1 minute on the other things, and you never spend enough time on the other things. So as a coach, I get to you guys got to do this core work. So we're doing all those exercises you just described. The Myrtles. We do the Myrtle. A routine every other day, and then we do the planks and bridges on the other days, and I try to do it with them every day. And has it helped? I'd like to think so. I was telling Dr. Rob, my goal this year is to reach 30 years. This will be my 30th year in a row running 2,000 miles in a year, and I'm about 80 miles away because I took 10 weeks off this year with my issue, but I'm going to make it. And so, but doing that stuff in the last 10 years. It's made a big difference. It's really helped keep me healthy. So that all that stuff.
Absolutely. If I could tell everyone here, I can give you a prescription, and that magic prescription will decrease your arthritic pain. Okay. It will decrease your heart rate. It will decrease your chance of hypertension, type 2 diabetes. I have a prescription for that. Would you take it? Yeah, you probably would. It's exercise. Exercise is the best medicine. So the fact that you guys all run is excellent. You need to become stronger runners, especially as we mature, because we're more vulnerable as we get older. And I'm older, I get it. I'm a slow runner. I love it. It quoted me in Runner's World. They say, Dr. Rob, why do you run? I said, so I can, eat pizza and drink beer. So I'm like, great. That's all my patients love that. But Yeah, you know, that's why we do. We want to keep moving, we want to stay active, we want to stay mobile. But mobility is something that we lose as we mature. So you have to work harder on your mobility. Do you have a question?
Yeah, actually, if there is a chance. Do you specialize in anything other than ankles? And
I do a little, you know, brain
because
surgery.
I had few issues over my running career.
Yeah.
I had plantar fasciitis, but it's nothing. My weak point, and it's been for a long time, is finally what I did piriformis.
Piriformis, yeah, piriformis syndrome.
Lately,
Pain in the butt, right? Yeah.
Lately, I found on the internet that they have new kind of stretches, which
Yeah.
is like wonderful. And you know, like sitting on a tennis ball.
Yeah, yeah.
And what could you recommend?
Yeah, so I like things
Can
like
I,
that.
can I just fix it so it's completely healed?
You can. It's gonna
Because
take
you know,
time.
I managed to keep it under control. So I can run, I can train it in a high intensity, but it's always there.
So a piriformis injury is something that will take time, and it will take you working at it, you know. So I like people sitting on lacrosse balls, which is evil. It's a little medieval if it hurts.
I
but
like it, even if
yeah,
it's evil.
yeah. Try to use a tennis ball. Try a lacrosse ball.
Yeah.
I call it like flossing. You know, it's like flossing your body, right?
Actually, I do have a
better.
lacrosse ball.
Yeah, that works really
Yeah.
well. I mean, work on the areas distal and proximal to it too. So you should be foam rolling your back. You should be foam rolling your hamstrings, foam rolling your calf and your IT band as well. So that would also help in that area as well. So it's not just focused on one thing. You know, we're a kinetic chain, we're a chain in motion. So what happens at one spot is going to affect another spot. So you have to do these things to get stronger and get more mobile.
So it's actually, you know, all those strength exercise on core also, right?
Yes, sir. Yeah. Yeah. There's a lot of great books out there that talk about it, but like Anatomy for Runners by Jay Deshari. He's a physical therapist from Oregon. He can read a lot of this stuff. You can read Jonathan Beverly. He was the editor of Running Times for the longest time. He just has a brand new book. It's Your Best Stride. Brian Fulham is a podiatrist out from. Oh, there you go. Yeah. So Jonathan is. I'm in that book, by the way.
So am I.
Yeah.
Reno.
Are you really?
Reno is too.
Yeah. And the one before that too. Do you have the one before that?
No,
Your Best Stride. Yeah.
Reno brought this today.
What is the meaning of hungry in the title?
Reno of what?
The hungry.
Oh, Run Strong. So it's actually a book about
pizza.
You know,
Longevity.
longevity. Yeah. How do you want to continue to do this? Oh, I had enough of this. Forget
It's an
about it.
American thing.
Yeah. Yeah.
Yeah,
Yeah. So
is
stay
it
hungry.
hungry for success or
Yeah.
hungry about dieting?
For longevity.
Mainly
Yeah, it
he's on
doesn't,
the
you know,
runners
a lot
that
of the
have
American
been
things
running,
translate into.
like myself, since from high school through forever, a long time.
Yeah.
Most of the runners, I think he said, averaged over 30 years of running.
And what's another thing that you should consider afterward is that we never talk about recovery, right? So we run, and then we get hurt. So you got to listen to your body sometimes, especially as we get older. You know, so maybe you can't run 55 miles a week, you know, when you're 53. Okay, but you can do other things, and you can take a day off. It's okay, right? As long as you listen to your body and do the things you want to do. So, you know, there's lots of things you can do for recovery, active recovery, compressive sleeves, compressive hose, recovery sandals like the UFOs, which are great. Cross train, yeah, like you said, all those things are really important. So, you know, just don't focus on running. You know, we find that like we talked about heel pain at the very beginning. Most of my individuals who are ball sports players as well, so maybe they play soccer or basketball, have less heel pain, less injury altogether because they have lateral motion, right? They do this. Runners do everything linearly. You know, triathletes do everything linearly. So they don't utilize their side-to-side muscles. So find time to do those things, you know, on your day off. If you are injured, work on it.
When I was young, my coach made me to do it. Now I'm too lazy.
Used to be a football.
Yeah, well, you know,
Europe's more progressive in the plyometrics. Now the U.S. is catching up.
Yeah.
I mean, as the high school, you don't see any high schools don't do it, right?
Mm-hmm. Yeah, it's very common.
So what's the other big problem we have? And you know this because you're a student. You do a lot of this.
Yeah.
This is the stance, right?
This
Stance,
Text neck.
right? And you do a lot of driving. So, you know, this is you're gonna be like this before you know it, right? So you have to run tall, you have to, you know, stretch, do yoga, whatever it is, you know, you have to work on that because this is our society nowadays.
It's not only that, but sitting literally aggravates my piriformis.
Absolutely.
Very badly.
Sitting is the new smoking, right? It really is. It's become an epidemic. You know, when you were a kid, how old are you? Do you mind me asking?
7, 8.
God bless you. Looks great. Yeah. So when you were a 12-year-old, you were cross-training. You didn't know it.
I was 25 when I was.
No, but you were cross-training. Yeah. You were climbing
he was
trees, and
saying,
you were riding your
yeah.
bike, and you were jumping over fences, and you were playing soccer.
I
You know,
was doing all
we don't. That's
Yeah.
cross-training. You know, it's like fartleks, right? What's fartleks? Fartleks is fun play.
Speed play.
Speed play. It's fun. It's a Swedish word for fun. So figure out a way to have fun when you're doing it. You know, that's important. Don't make, if you're running and it's becoming a chore, don't do it. You know, do something different. Do something to make it fun.
I also have not really a question because you said that you were against this injection, but I want to give you an example of it's from Europe. My brother-in-law, he's not a runner, but he plays soccer, whatever. And he had developed really big Achilles problem, really bad. So they first tried conventional stuff like icing, heating or whatever, nothing helped. They took an MRI. They told it was supposed to be like 2 millimeter. It was like, I don't know, 5 times as big. There was a liquid, they pulled the liquid, and they did to him, after nothing worked, they did those blood platelets injection.
PRP.
And three sessions, and
They don't do it here, it's not covered under insurance.
Yeah,
they
we
do
do
it.
it. I mean, we
Well,
do it.
you
Yeah.
do it, but it's not covered. It's another one of
But
those
the
non-covered.
studies have shown that PRP, they did a study with PRP injections and just needling the area without putting the PRP in, the needling scored higher
really?
than just the PRP. So, for free. So if you want to come to my office, I'll needle you if you want to do that. That's for free. I'll do it for half the price.
Try needle.
No, but that's where it's not like
By the way,
shockwave.
somebody said that, you know, all those techniques, the kneading or whatever, is just to aggravate the area and
Correct.
stimulate the body to.
Yeah,
Yes.
I mean, yeah.
Yes.
Eastern medicine does acupuncture. It's very similar. It's all to
Especially
increase
tendons.
angiogenesis, blood flow to
Any
that area.
tendon. It's the only way to
Acupuncture
get
helped
blood.
me. I had plantar and acupuncture helped it a lot.
Okay,
Yeah.
and I want to bring another example, talking about the food problem.
Yes?
It's very important to us because we have a teammate and we want him to come back. And he complained that no, you know, he had a long break from running and now when he tries to run, his foot was hurting terribly. He could only last like 3 miles. And finally, he had a session with his chiropractor or whatever, and they discovered he has a flat foot. And what happens is that when he runs, some bones, you know, like, so what they did, some inserts.
Yeah, that's fine.
And he claims that now he can run without pain.
Good. If
Over-
it works for him,
over-
that's great. I don't, once again, having a flat foot is not a diagnosis. Having a flat foot is who you are. It doesn't make a difference. He might have had, you know, his preferred movement pattern was what needed a little bit of help. So a shoe, an orthotic, should help that preferred movement pattern. So maybe it was doing that. It shouldn't try to change
Very
it.
likely because his strides is awful. I mean,
Yeah.
when you see him running, you would never expect that he can
Yeah.
run so fast.
Thank you. Those are all really good examples.
Can I just share one more
Yeah,
thing?
please.
So, talking about the aging runners, as a lot of us are, I started doing the run walk a few years ago.
Galloway.
And so I've been running marathons since 1982, so 35 years. And I said that would never do the Galloway stuff. Never. I mean, come on. That's for the 5-hour crowd. I would never do it. But my daughter was a triathlete, and so with a Olympic development program, and she came home from her first few months of training with this group. She says, "We do run walk." You kidding me? And so they run 9 minutes and walk for a minute, for however long. So we went out for a 10-mile run when she was home, and I did the run with her. oh yeah, it wasn't so bad. You know, we weren't really that much slower than I would expect. And so I started doing like one day a week. I was doing it, and I decided, all right, I'll do the New York Marathon. This was 2 years ago. 2 years ago, yeah, I did the New York Marathon, doing run walk, and I did 8.5 minutes running, 30 seconds walking, and I ran 3:09, and it was equal to my previous 5 marathons, the average of my previous 5 marathons. Wow. The best part though was I woke up on the couch after a night, and about 1 o'clock in the morning, and I was ready to pick up my leg and get up, and I was like, oh, I got up, I walked, okay, I'm fine. Next day, walk down the stairs just like normal. Wow. Usually you're like, walking down like this or walking down backwards. No severe calf pain. I mean, there was general muscle soreness. So I became a Galloway disciple now. I don't know the guy at all, but I've now do all my running that way. I train, so I'm able to train more effectively. And I've experimented with it, but I do generally 30-second walks. Sometimes I'll do 1-minute walks, but I'll do 8.5 minutes. I'll do 7.5 minutes. I'll do 5 minutes. I tell you, it's made a world of difference. And yet I haven't slowed down at all. In fact, I ran 3:08 at Hartford this year, and then 3 weeks later did New York, and I just did New York like a fun run because I just have done New York a bunch of years in a row. And I ran like 3:19.
How many, Kevin? How many?
I've done 28 years in a row, and that is a streak. I'm not a running streaker, but that is one of my streaks. But doing the run walk, it's a tool that you might want to check out at some point because it has really worked. So just that recovery, that little bit of recovery that you get during your course of your runs, the muscles don't break down as much.
I do it. I use the app. Or you could get on your Garmin or your Polaris or
yeah,
whatever.
the Garmin you could set it.
You set it to it. I started with C25K, and that's how I do it. I'm running a New York half this year because last year I went at the finish line to watch my cousin. I'm gonna put it out there. Callum Hawkins. Anyone know Callum Hawkins is? So he's the 3rd best marathoner in the world right now. He finished it in 60 flat last year, the half, and I'm like, I could do that in 2.5. So yeah, we're gonna try to do it this year. So yeah, I think that's a great way to train. I think it decreases your injury prevention. So perfect.
I just don't let my high school girls see me walking.
On now it seems the fad is the stiff shoe versus I've always, and I feel I run more efficiently on a shoe that bends at the forefoot with the toes.
Oh yeah, that was always
and
my
the ball.
philosophy. I couldn't stand shoes that are
and a shoe like the Hoka, which is a lever shoe almost.
Correct, it is. It's a rocker bomb.
Yes. I just...
Yeah, so I mean, let's talk about that. So,
because now the foot's not functioning.
I mean, it's crazy right now, and that's why I like 361 because they're not trying to come up with a gimmick shoe. They have all different types of shoes. So, and I think Hoka has, they've owned that area of having maximal cushion, but it's the rocker more than anything that it's what it's all about. So, I love that shoe for an individual who just does not have motion at their first metatarsophalangeal joint. So you say, wear this, they're like, oh, I can. They can't wear that.
No, because I work in a running store also, and I had somebody come in that had their big toe was fixed.
Yeah.
And of course,
so
you can't beat that for them. But for the normal foot motion,
it's kind of, I don't like the way it feels, to be quite honest. For me, I feel very dissociated from the ground. But some people love it, it's all unique, whatever you like.
To me, just that flexibility that the shoe can bend there.
So you know what I feel too, though, and this is a plug for Kevin, is that I don't think you have to be monogamous to a shoe brand either. I think it's okay, say I want to wear different shoes for different
No.
No. But if you are, it's nice to find a shoe brand that has multiple different platforms.
Yes.
Which is important.
So you don't get this
which like 361 has. Yeah. So it's okay to go to different types of shoes and different, heel heights and all. So that's the take-home message there. But you're starting to see like every shoe has a maximalist shoe now.
Yes.
Ultra has the Paradigm. And, you know, Nike just came out with their new funky shoe with the rocker on it that they just tried to do the sub 2.
The 4%.
Yeah, 4%,
Yes.
right. So, you know, there's a lot, and it's just trending. You'll see it. And then, you know, when you were running, you probably, when you first were young, you wore a waffle trainer.
Actually, it was banana shoes.
You were banana shoes. There you go.
Banana
Yeah,
shoes
you were
in
Earth
high school.
shoes, right?
Yeah. Seriously, they were. They looked like, you remember those?
Well, they have the
those-
curve last.
Yeah,
like-
yeah.
Yeah, they
Nike came out, they
Yeah.
were one of the first ones. You'd have a curve to the shoe.
Yep.
Because they're thinking that you were going to the big toe to push off on.
It's all marketing.
Yes.
It's all marketing.
You
It's
don't
all
see it
trending.
anymore.
I mean, you
Versus
know,
a straight last shoe.
I mean, you know, 361 uses quick foam, which I love. Saucony uses something very similar. They all have similar
All
things.
have their
So
thing, right.
yeah, they all kind of, you know, cheat from each other, and they're all. It's very incestuous, the company. So, how I got involved with 361 is that I've always been very involved with ASICS in the past, and a gentleman named Jim Monahan, who's now the vice president, I believe, right?
He's the CEO.
CEO. Okay. He's a CEO. And
Jersey guy from
he's from Mahwah.
From Mahwah,
So I
New
knew
Jersey.
him.
Graduated from Montclair.
Yeah.
School of
He
Phys Ed.
was one of the main guys at ASICS.
And by the way, just to interrupt, he was when I used to be the ASIC rep in the early '90s. He was my tech rep.
Yeah.
Well,
So really smart guy. Uses really
What
smart
did I do wrong?
individuals like this. But he started 361 with a lot of those concepts of things that went wrong, because that's how you learn, right, from things that went wrong, and put it into this shoe brand, 361, which I love because it's an everyman shoe. It's got a different platform for lots of different types of runners. So good stuff.
I just want to go back to what Dr. Rob said. So I developed a pain on the outside. I had developed a pain on the outside of my left foot, and it just gradually got worse and worse. So it got to the point where every time I planted my foot, I'm a fifth metatarsal. So it was like, and then my heel started to hurt. So my friend / coach Rich Byrne, who's friends with Rob, directed me to Rob, and I went and saw Rob, and he did that test, you know, the squat test, and it looked like your test. Okay. So he said, you know, so what he did was, the first thing he did is I didn't have to stop running, which made me very, very happy. The second thing is, you know, he treated the pain, but he also, you know, had me work on the cause of the pain, and the cause of the pain was the weak hips, the glutes. So it was, so I did the shock treatment, but in addition to the shock treatment, you know, I did exercises, you know, that we spoke about in your office. So it was the combination of the two, in addition to cross training, and then some patience, because at the first 2 sessions, I really remember, I really wasn't.
He was very skeptical.
I was very skeptical, but I figured, you know, I'm going to spend about that much money in trying to find some self-medicating device or tool. So I decided to roll the dice and roll the dice, and I got, you know, very, very, very good results from it. So
I'm lucky enough to train residents, and I always tell all the residents they're young and they think they know everything. I go, you know what it is, you know it's peroneal tendonitis, you know it's plantar fasciitis, but why? More important to treat the why than the what.
Yeah.
So, you know, that's why I try to find a doc that does that, you know, and that's the one you want to stick with, because that's the one, you know, who listens to what your problems are and will figure out, you know, what your asymmetries are, where your weaknesses are, and how they can help everybody get better at that. Yeah, you know, this day and age, like, no young people want to be doctors anymore because it's not, you know, they don't make enough money, they say. They want to go into finance, right? But find a doctor who is, you know, who loves it, who has a passion for it. That's what's important. You know, find a doctor who comes to this place on a Saturday night.
for a beer.
Yeah. This is crazy for me, though. I don't get to do this. You know, this is a crazy Saturday night for me. So thank you, guys. I appreciate it.
Thank you.
All right, let's do a couple wrap